Hello everyone, welcome to Sharmit. In this session of medical coding, we will be mainly talking about a very important term, that is gross anatomy or macroscopic anatomy. In our previous session, we talked about what is anatomy, right? Where we discussed the basic introduction and the things like importance of anatomy, right? So these are the things that we discussed for the introduction purpose only. But now we are going to deep dive into the topic that is gross anatomy, because before we move further for the coding process, we should know what is gross anatomy and what is macroscopic anatomy. So basically this is the same thing, gross and macroscopic. And the second thing, like if we divide or categorize anatomy in two parts, so first one is gross anatomy or macroscopic anatomy, and second part is microscopic anatomy. So these are the things that we will be discussing in upcoming sessions in this session. So for today we will be mainly focusing on what is gross anatomy. So let's start from the definition itself. So if someone asks you in the interviews or maybe in examination what is gross anatomy, so you can just share the information whatever you are going to learn from this session. But before we proceed further with this session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for timing we are just mainly focusing on what is gross anatomy. But prior to that, you should know what is anatomy, what is medical coding, roles of medical coders and other stuff. Okay, and for that you can also refer the Sharmit digital course book, which is freely available in the description box. There you will find more than 3000 plus free resources, which is available in both Hindi as well as English language. So you can particularly look for the tab that contains medical coding sessions. Okay, all right, so now let's get started. So in this session, like, we will proceed in the very same way. Like, firstly I'll explain you the definition, then we will talk about the subdivisions of gross anatomy, and in the end we will take interview questions as well, that will help you to recall your concepts and also help to prepare well for interviews and job. Okay, all right, so let's get started. So we will start from the definition itself, that gross anatomy is the study of body structure visible to the naked eye without the use of microscope. Okay, so if we are doing the study of body structure without using any microscope, then that particular anatomy is considered as a gross anatomy, and it is also known as a macroscopic. Okay, because we are not using any microscope here. So if it is macroscopic, that means we are studying the body structure visible to that are visible to the naked eye without the use of microscope. Okay, so this is the simplest definition that you can refer, or maybe you can practice for your exams. Now if we further study the gross anatomy, then there are multiple subdivisions. Now remember one thing, each word of this session is subject itself. Okay, if you talk about the gross anatomy, so it is a separate subject. There are so many things that we can learn about this, but here we will go in the very simple way, like from basic to advanced level, so that firstly we will clear our concepts and then we will go in deeper dive. So here similarly we have subdivisions, like there are multiple subdivisions of gross anatomy. So we will see one by one which subdivision is for what. Okay, so first subdivision is regional anatomy. So regional anatomy means studies the body region by region. Okay, so if we are studying the body region by region, then in that case we will consider it as a regional anatomy. Okay, so here you can see all structure in specific region are studied together. So this is very important line, because if all the structure that comes under a particular or specific region, then we will study it together, and that kind of study is called as regional anatomy. For example, muscles, bones, nerves, blood vessels, all these things, if it comes under a same specific region, and if we are doing the study in region by region manner, so it is considered as a regional anatomy. Now let's take some example. First example is head and neck, thorax, abdomen, upper limb and lower limb. So these are the all commonly used example that will help us to understand the regional anatomy phase. Okay, now let's talk about the importance also. What is the importance of studying this thing? So you can see it is useful in surgery and it helps us to understand spatial relationship between the structure. So if you want to understand that structure, you should know the basics of subdivision or regional anatomy, not subdivision, regional anatomy. Clear? Fine. Now let's move ahead, and the next thing is systemic anatomy. Now what is systemic anatomy? So systemic anatomy is mainly the study of the body system. When we are studying the body system by system, then that particular study is considered as a systemic anatomy. For example, like here you can see each system is studied throughout the entire body. So in previous subdivision we were talking about region, we were studying region by region, but this time we are studying system by system. For example, we have multiple system, right? Skeletal system, muscular system, nervous system, cardiovascular system, respiratory system, digestive system, urinary system, reproductive system, and endocrine system. So these are the all systems that comes under a systemic anatomy, and we will discuss each and every system in detail as well. But firstly we will cover the basic thing, and then we will go deeper into these areas. Okay, now we have next thing, why it is important. So let's see what are the importance. So it helps understand functional organization, and it is commonly used in textbooks. Okay, so these systems are present in textbooks, and it helps us to understand the functional organization. Next is surface anatomy. Now what is surface anatomy? So when we are study, it is a study of external features of the body. So if you are studying the external features of the body, then that comes under a surface anatomy. It correlates surface landmarks with the internal structures. So that overall thing comes under a surface anatomy. Examples: pulse point, surface marking of hearts and lungs, bony landmarks like clavicle or sternum. So these all are the example for surface anatomy. And if we talk about the importance, then it is essential for the physical examination, and it is used in clinical diagnosis. Okay, so this is the third category or third subdivision of gross anatomy, that is surface anatomy. Now the fourth one is radiological anatomy. Now what is radiological anatomy? It is the study of anatomy using imaging techniques like X-rays, CT scan, MRI, ultrasound, PET scan. So these all techniques come under a radiological anatomy. Now what are the importance of it? It helps in non-invasive diagnosis. Also it bridges the anatomy and clinical practices. Okay, so this is the fourth subdivision category for gross anatomy, that is radiological anatomy. As I mentioned, there is so many things that we can learn about it, but for now we are just looking overview of it, so that you know at least the terms when we are referring it in the upcoming, like when we will be doing the coding, we will refer these terms only. Okay, so you should know about these things. Fifth category or subdivision is clinical or applied anatomy. That is the application of anatomical knowledge to the medical practice. Let's see the examples: hernia, fractures, nerve injuries, and organ enlargement. And if we talk particularly about the importance, then it is critical for diagnosis, surgery, and treatment. So these are the all subdivision. Now let's conclude this session with the importance of overall gross anatomy. So it is for foundation for surgery. It helps understand body movements, essential for clinical examination. So these are the all things that conclude what the importance of gross anatomy. Now as I mentioned, now I'll be sharing you one interview question, that is, what are levels of anatomy? So if someone asks you what are level of, I'm sure like you all know about the answer of this question, because in last session we discussed this in detail. But still, if you don't know the answer, don't worry, like you can refer the previously released session. There you will find the session in detail for this particular thing. And I request you to please do share your knowledge in the comment section for this question, because it will not only help you to recall your answers but also help you to understand it will also help others who don't know the answer, so that they can directly refer it from the description box. Yeah, so yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.